opposite activity also. So because of that, we should always remember that anything that we see is a suitable model for testing of these drugs. And any drug that enters a market has to be tested in lower animals. When we prove the efficacy of that particular drug in lower animals, then only it becomes fit, or it is deemed as fit to enter into a clinical stage. Clinical stage in the sense of testing on the human beings. It may be a group of small group of healthy volunteers, it may be a small group of patients, or it may be in a particular hospital based studies. It's all part of clinical trial. But when somebody has invented a particular drug, when somebody has isolated a particular drug, when some scientist has synthesized a particular drug, we cannot directly give to human beings. It is unethical. Same thing stands for animals also. Suppose if we are testing a particular drug on animal, it is quite a torture to the animal, because we are interfering in the natural life cycle of the animal. Maybe we are making a fracture of the legs, where maybe we are blinding that particular animal, maybe we are doing skin toxicity studies. It's all torture, but still we depend on the animal studies only, because our basic data or our noble intentions, that to manufacture or to synthesize or an isolate a particular drug that is useful not only for human beings but for animals too. Today we have a veterinary science department. So if any particular drug is invented, animals also do suffer from so many diseases, like stress induced disease, or infectious disease, or hormonal disorders are also quite possible in the animals. So we need drugs for them also. So as a pharmacologist, our vision should be quite broader, that whenever we isolate a particular drug, whenever we want to test a particular drug, it involves animals as well as humans also. So that should be the noble intention. Then only we can treat the animals also as well as humans also. But we take it for granted that animals, since they are not organized, since they cannot protest, since they cannot form a group or an association, it is not the right of human beings to test the drugs on the animals. Nobody has given the rights. It is the same nature, same God who has created the human beings has created the animals. It is the same pain perception, it is the same type of stress that what we undergo, animals also do undergo the same stress. So because of that, it's not our right to test. But however, since the intentions are very noble to find out a new drug, both for animals as well as human beings, scientific community or various organizations across the world, they permit the scientists to test the drugs on the animals. Earlier, we have all seen frog was one of the rampant animals that was exploited. Today, we do not use any experiments on the frog, or using a frog for an experimentation, either for demonstration, either for testing, is an illegal act. Entirely frog experiments are totally banned. The reason behind is, suppose if there are around say 1,000 universities are there, maybe in 1,000 universities, maybe 10 to 15 lakhs of the students are pursuing biological based studies. It may be a medical science, it may be a pharmacy science, it may be a veterinary science, it may be a zoological science, it may be a biotechnology science. All of them we depend on the animals only. But when we all start using these rats for these frogs for a particular understanding of a particular gland, or we dissect them or we kill them, it, you can imagine, per day 10 to 15 lakhs of frogs are killed. Now we are permitted to kill rats and mice. Now a question may arise: why rats are permitted, but why not frogs are permitted? Not permitted, or it's banned. The reason is very simple: rats can be bred in the laboratory, and mice can be bred in the laboratory. So only the animals that can be bred in the laboratory are permitted for usage as experimental animals. The things that cannot be bred in the laboratory are not permitted. For example, frog, you give any type of condition, any air conditioned environment, whatever type of food that is there, you cannot breed the frogs. It is not possible to simply breed. Frogs only grow only in a natural environment. There only they lay the eggs, and there only they flourish. And suppose if we take out these frogs at this rate per day, 10 to 15 lakhs of frogs, if they are started dissecting for various purposes, as we know n is equal to 6, that means at least to present a particular data, to publish a particular data, we need 6 animals. Suppose if every had 3 groups of animals, that is 18 frogs for one scientist for one experiment. So this will cause an ecological imbalance, because if frogs are totally gone, then snakes will start entering into the homes because it is their natural food. So it is an ecosystem or a eco cycle, because of which there is environmental imbalance. Hence, all the scientists and all the governments across the world have banned experiments on the frogs. Now, coming to the experiments on these rats and mice, we can breed them. If you give conducive environment, or if you allow male and female rats and mice to mate in the laboratory with sufficient adequate quantity, they start mating, and within 25 days, you will get a colony of rats and mice. Hence, they are permitted, they are rampantly used. So this is only a preamble I am giving. What is the screening module? What is meant by preclinical screening? Now I will give one or two examples that is sufficient for you to extend this logic wherever you see a particular animal. As I said, every animal is a suitable model for experimentation. But since because every animal is a model, we cannot every institute or every level we cannot bring those animals. So only at a higher, suppose if a monkey is a suitable model, or primates, which very closely resemble with that of human beings, we cannot conduct experiments on monkeys at a regular laboratory. Unless and until it is a national level laboratory where where the chemical has almost become a drug, then only we are permitted to use those monkeys or those primates for testing the drug. Otherwise, for a regular laboratory, rat, mice, guinea pig, rabbits are the common animals that we use it. So, what are the other animals? How we should, as a pharmacologist, how we should broaden our vision of the animal experimentation? I will start with a small example of a spider. Spider we see in our house, or everywhere, everywhere we can find a lot of spiders, and we find a lot of cobwebs. Cobweb, the spiders form a particular pattern of a hexagonal pattern. All of you have seen that one. So when that is a pattern of this one, now spider is a very good model to study any of the drugs that affects its thinking pattern. That is, every spider forms a perfect hexagonal web. If a particular disturbs its activity, then it cannot form a hexagonal web. It is impaired. So, to test tranquilizers, to test the drugs that act on the central nervous system, to test the drugs that impair the thinking process, we can use spider as a very good model. We are starting from a small thing like spider. Then, depending on the type of the animal, what type of animal it is there, and depending on the type of the drug that you are inventing, then we can use a suitable model. Suppose if you are using anthelmintic activity, small earthworms are also one of the very good models. We can test on earthworm whether it is anthelmintic or not. Similarly, so many anything you name any animal, you imagine any animal, that is a good model for us. Now let us enter forests. Elephants are there, tigers are there, lions are there. They are also wonderful models. Basically, the tiger is a ferocious animal. Lion is a ferocious animal. So suppose if a tiger enters into a city, so what we do it, we should not kill that one. Instead, how to catch that one? Otherwise, it will create a menace. So how to catch is, we use a tranquilizer gun and then shoot that animal with a tranquilizer. After the animal is tranquilized, we pick that animal and rehabilitate it to the forest. It can be any wild animal that you imagine. So now we should know what type of drugs act as tranquilizers and what is the dose required to shoot that animal to produce a tranquilizing effect. So for that we need to test the animals, test on the animal. So tiger is also suitable model. Because it is a suitable model, colleges cannot afford or any laboratory cannot afford. Basically, they are national animals. Nobody is permitted to kill. However, we cannot stop the experimentation. That is, we should have an idea that if this is the dose required, 30 milligrams is the dose required to tranquilize a particular rat. So extending that dose to a tiger weight, we should know that this should cause a tranquilizing effect in that particular animal. Same thing. Now we tiger and lions are normal examples. It can be a case of elephant also. Elephant also which weighs in tons. So how to tranquilize her when that elephant enters your fields, or it enters your maybe a village or a home and starts trampling. So we should know the dosage. We should be in a position to calculate the weight of that one, approximate weight, shoot that animal with a tranquilizer gun, and then tranquilize animal, then catch it and rehabilitate. Same thing with snakes. Snakes, we know snakes are very ferocious creatures that we find them. So reptiles, very, it may be crocodile, or you imagine anything, anything that you imagine. So suppose now if a particular drug can tranquilize a cobra and help in catching, then we can rehabilitate it. So snake is a very good model. Tigers are a very good model. Lions are a very good model. Name anything. Hyena is a very good model. Cheetah is a good model, or anything. That is basic ferocious activity is there. If a drug can control that basic ferocious activity, that means it is a highly effective tranquilizer. It may be sedative, it may be hypnotic, it may be a tranquilizer, it may be an anesthetic. So this is how we should open our vision. Or it can be in birds, it may be fishes. Simple, simplest example of a fish is, suppose if you keep two Siamese fish in a pond. If two male Siamese fish are kept in a pond, they start fighting with each other. So how do they fight without any hands or limbs? The fighting style of that Siamese fish is that they start releasing particular colors. Particular colors they start showing on their skin, so that it is a ferocious sign to the other fish. Now suppose if you put some drops of your tranquilizer into a fish pond or a tank, and suppose if they stop fighting, that means it is a tranquilizer for that particular animal. So same thing in water also, we have so many sharks are there, fish are there, so many things are there. So that is also very good model. So it may be models that are simple. Ants are there. Ants are a very good model. Ants, they, you can see ants, they move usually in a particular style of a queue or a long line. Suppose if that is disrupted, or if their capacity to carry something sugar molecules is disrupted, it can be a drug that has either altered its thinking pattern, or it has altered its communication skills, or it has altered its caused a paralysis in their body, so that animal is unable to pick up a sugar molecule or a crystal. So this is how we have to think. So right from an and, or that is also okay. All these things we can see. I can catch a bird. I can catch this one particular thing. Suppose if we are using a microbial sample which is not seen. Microbial sample is also very good biological experiment for pharmacologists, because antibiotics we test on microorganisms only. It may be antifungal drug, it may be an antiviral drug, it may be an antibiotic against a particular bacteria. So we need a particular biological sample, microbial sample, by which we can say that this is a particular drug. So thus, microbiology is also a part of pharmacology. Microbiology, they have specialized. As today we have a doctor is MBBS, doctor is a doctor who can treat all the patients. He can treat eye diseases, he can treat ENT, he can treat anything. Suppose if he specializes at MD level or MS level, he becomes only an eye specialist. He doesn't see like an MBBS doctor. He wants to see only an eye. He wants to see only an ear, or he is only an orthopedic doctor or a gynecologist. So as the studies advance, they become very particular or very specific to a, or restrict themselves to a particular type of treatment or this one. Same thing here also. So that is, whenever we use a particular animal, whenever we use a particular specimen and start testing a particular drug, our vision should be clear that this becomes a particular model. Same simple analytic activity, we have to induce a pain. Then we say that whether given drug is an analgesic pain relieving agent or not. Anti-inflammatory drug, we have to induce an inflammation in the animal rat. Method can be anything. Method, you may inject albumin, or you may inject a formalin, you may inject acetic acid, or you may put a cotton ball into the foot pad. You can put anything and cause inflammation. Then give your drug and say that yes, the drug produces relief from the inflammation. So we have to first induce that symptom. Suppose if it is coming with the symptom itself, it becomes more easy. That is how today we have transgenic animals. That is, by birth itself, the rat is a obese rat. By birth itself, the rat has lost its thymus. We call it as nude rats. By birth itself, the rat is a diabetic rat. By birth, the rat itself is suffering from a particular diabetic disease. So that we have more time and we can test them. So every animal, every model, so there we are inducing symptoms. We have to induce the symptom. Suppose anti-cancer drug you want to test, you have to induce cancer, then you give your drug and say that given drug is an anti-cancer molecule. However, if some of the behaviors themselves are markers to us, as I said, the example of a tiger and a lion, basically ferocious animals, we need not have to induce a ferociousness into those animals. Basic models for the ferociousness. Same thing with a dog, or it can be, that is also basically ferocious. Same thing with a monkey, basically ferocious animal. So they are the natural models for testing sedatives, hypnotics, or tranquilizer like drugs. Suppose if it is a rat like animal, then we have to induce a particular symptom for an anti-inflammatory activity, for an painkiller activity, for a muscle relaxant activity. Something we have to induce, then we have to test, yes, the drug is so and so. This doesn't happen in case of basically the animals which suffer from a, or which have a particular specific behavior. So that is how today every animal, everything that you see can be a wonderful model, and we should know what kind of drugs we can test in these things. So many models are unfit. So many diseases that are common in human beings are not common to the animals. Suppose if we drink a water from a nearby drainage, we will fall ill. It's a very simple example, isn't it? Or even tap water also, if we drink from some other place or in a hotel, which is not hygienic, we start suffering from gastroenteritis or cholera or whatever it is there. But imagine the life of a worm, imagine the life of a frog, imagine the life of particular insects, or imagine the life of pigs that dwell in the ponds, dirty ponds only. No infection comes to them. Frog, not infected, they stay in dirty ponds only. So what is that quality that gives that immunity to that particular frog from that affecting diseases? Same water, if we drink, we start getting infection. So this is where our doctorate students or postgraduate students should start thinking in an innovative way. Why this particular species never gets any disease, even if, because infectious diseases are from bacteria, it can be from fungi, it can be from viral diseases, but why they don't get viral infection, why they don't get particular fungal infection, even though it stays there, it completes its life cycle, becomes adults in whatever lifestyle that has been given to that particular animal by the nature or the god, whatever you call. Everything has its own lifespan. Maybe frog lifespan of 1 or 2 years, or rats are their lifespan of 1 or 2 years or 24 months, or if it is a dog, lifespan of maybe 10 to 15 years. If it is a cat, lifespan of 10 to 20 years. If it is an elephant, maybe lifespan of 35 to 40 years, or if it is a cow, a lifespan of 20 to 22 years. So every species has its own particular lifespan that is bestowed by the nature. For human beings, it may be 100 years. For tortoise, it may be 1,000 years. So this is the lifespan that has been bestowed by the nature. So they complete that lifespan of 2 years or 1 year, or if it is a butterfly, maybe one day itself is a lifespan for it one, but it completes that life cycle in that particular environment. So this is where innovative thinking starts. We should become innovative. That how preclinical screening or preclinical trials are done. So without going much into such aspects, because basically it keeps on taking a lot of time, and it's more interesting also, we will come to point by point to the topic that has been allotted to us. So but once you have this preamble in your mind, that becomes very clear for you how to proceed further in this one. Now coming to the preclinical screening that is there, from where we do get drugs, this is the first question that we start. Various sources of the drugs, maybe it is a plant product, you have extracted a particular plant leaf or a fruit or a seed or a bark or a stem or a root, or whatever pulp or whatever extract that are flowers, you have extracted something. So that is your first stage of drug. Or it may be from a microbial extract, as penicillin is from microbes only, cephalosporins are from microbes, streptomycin is from a microorganism, isn't it? So that is also a source of a drug. Or it can be a synthetic, aspirin is a synthetic drug, sulfonamides are a synthetic drug, so it can be from a synthetic origin. Or it can be from a biotechnological origin, or it may be from an animal extract, as we extracted today, heparin is extracted from the animals. Then we extract so many blood products are extracted, insulin is extracted from the animals, antivenoms are extracted from the animals like horses, etc. So we get drugs either from a natural source, or from a synthetic source, or from a biological source, or from various of mineral source. Then we want to make it a drug. That is our motto. So now today, if I start making a particular compound into a drug, how much of time it requires? How much maybe you have joined as a scientist in a particular laboratory after your M Pharma or after your doctorate course. If you join as a scientist in a particular organization, only to find out a new drug of a particular brand, maybe for a heart, or maybe for a cancer, or maybe for atherosclerosis, or whatever type of drug that you imagine, it usually requires 1000 crores. Usually 1000 crores is required to invent a particular drug. How much time it takes? It takes at least 15 to 16 years of the scientist's lifespan to find out a drug. Then what are the chances that he will come out with a particular drug? The chances that if you test 10,000 drugs, 10,000 molecules, not the drugs, 10,000 molecules or 10,000 chemicals, one is likely to become a drug. That means remaining 9,999 molecules are rejected outrightly. Suppose if you have started a pharmaceutical company, your basic investment itself is maybe 500 crores. You have started a company, maybe with 1000 crores, you have started a pharmaceutical firm with maybe few 500,000 employees. You have to meet the salaries, you have to raise the infrastructure. And if you spend 1000 crores only on one scientist for one molecule, you can imagine what will be the position of the particular invention. That is how in India not many drugs are coming, because being a poor nation, the companies are not in a position to spend so much of money for drug research. But anyway, at various levels, that is another debate. We will not enter into that domain. So now our interest is how to screen a particular molecule when we get from various sources. So when we get from various sources, what first we are supposed to do, or what is the purpose of that molecule? Our main intention is to find out a new drug, or to find out a new mechanism of action, or to add to the information that is available already in the drug domain, or to screen a particular molecule so that it becomes a very good experimental tool. Suppose if histamine is synthesized, some company is synthesizing an histamine. So histamine, what is the use of histamine? No use for the histamine at all. Because the moment you touch with your hands, you will start we will start getting itching sensation, anaphylaxis, and so many things. But still histamine is produced. It's very much available in the chemical industry. Purpose is because it is an experimental tool. We want to invent a new antihistaminic drugs. So first we should have histamine in our hand, induce that anaphylaxis, and say that our drug prevents that anaphylaxis. So that is how our research starts. That is, if it doesn't become a drug, at least it will become a very good experimental tool. Same thing with acetylcholine. Acetylcholine has no clinical use in the therapy, no clinical use, but still acetylcholine is available because it's a very good experimental tool. With that acetylcholine only, we find out new acetylcholine drugs, or cholinesterase inhibitors, or so many anticholinergics are invented. Use of atropine is there, homatropine is there, eukatropine is there, so many other drugs are there. So this is how we need all this information in our drug discovery. So we have seen the animal aspects of the drug discovery, what animals are required. We have also seen the various sources from where we get a particular drug. We have seen what is the purpose of doing this entire exercise, so that The new molecule is better than the earlier one. The new molecule has less side effects compared to the earlier drug. The new molecule has a better mechanism of action. The new molecule has a rapid onset of action. The new molecule is very stable. So it should have some advantage. For that, all we have to do is animal experimentation only. No instrumental experiment ever will substitute this animal studies, because chemical assay is there, HPLC is there, HPTLC is there, or whatever you imagine. They only say what is the purity of a compound. Compound may be 99% pure, 100% pure, but they don't tell whether it is having pharmacological activity or not. It's not possible. So again, we have to depend only on the animals only. So various animals are there. So what is this all about pharmacological screening? Now we'll see one by one. So how to begin when we have a particular drug, a chemical in our hand? How basically we have to begin this one? So this is called as screening program. So what is this screening program? In screening program, we have primary screening and secondary screening. Primary screening is also referred to as dirty screening or ordinary screening. Secondary screening, we go little into the deeper aspects of this one. So what is this primary screening? Primary screening, or why it is called as dirty screening? Because let us say I am from a very small pharmaceutical firm. I have a very small company or small R&D institute. I cannot spend 1,000 crores. I cannot hire a scientist for 15 years and spend so much salary and money for inventing a particular drug. But still, I am interested in finding a new drug or a molecule. So there we have to go for this primary screening or this dirty screening. The meaning is that we all know that yes, this particular plant is useful for particular activity. So what I do is I get a hint from the particular activity, depending on the it may be alkaloid, it may be glycoside, it may be tannin, or it may be whatever the chemical constituent is there. I have a hint in my hand. Suppose let us say I find a structure, it is an ester. If it is an ester, in all probability, it can become a very good anti-inflammatory analgesic drug. So now what I do is I forget all other pharmacological actions, whether it is a CNS stimulant or a depressant or a tranquilizer or a hypertensive, hypotensive, diabetic, anti-diabetic, or a laxative or a purgative or a constipating agent, anti-arthritic drug, whatever it is, I forget. Now my intention is there only because the drug has this molecule, amide structure, drug has a ester molecule, drug has this structure or a barbituric acid nucleus. I test it only for that activity, sedative and hypnotic activity. Let us say what I have extracted has a barbituric acid nucleus or benzodiazepine nucleus. So now I close all my ears. I am only interested in sedative and hypnotic activity. If it clicks, it may click also, because the structure says that it is a barbituric acid. So it, in all probability, it may click. So if it clicks within a short span of time, we have a wonderful drug in our hand. So as everything, the coin has other side also, other side of the face of the coin. Advantage is little money, little time, I have a drug. What is the disadvantage? Disadvantage is that simply I have tested it for sedative and hypnotic activity. The drug may be a very good anti-Parkinsonian drug. The drug may be a very good anti-diabetic drug. The drug may be a very good anti-cancer drug. The drug may be very good for alopecia. The drug may be a very good drug for some other constipation activity or something, any activity that you imagine, which I have missed because my focus was only on sedative and hypnotic activity. That because of the structural precedence of that molecule, I have tested only this one. So every study has an advantage, has a disadvantage, depending on your resources, depending on your studies, depending on your requirement, depending on your capabilities. You choose which model of study that we have to do. So that is about primary screening. So next is a broad-based screening. In case of broad based screening, what we basically do is, now I take a molecule, I have a little more money, my facilities are better. So today I do analgesic activity, tomorrow I will do anti-inflammatory activity. In the sense, any time, maybe after 1 week, 10 days, whatever the time it is there. Then next week I will do local anesthetic activity, then I will do general anesthetic activity, then I will do activity on GIT, then I will like do activity on heart, then I will do activity on the skeletal muscle, then I will do activity on the endocrine glands. So like that, and the activity on the eye, activity on the ear. So whatever you imagine in the pharmacology, he keeps on doing all those studies. So again, this also has two faces for the coin. One is advantage, one is disadvantage. Advantage is that now you are not missing anything, no chance. Somewhere it will have some or the other activity. This is an advantage. So what is the disadvantage? You are losing lot of money, you are losing lot of time, you are losing lot of resources, you are killing so many animals. Today I have done on rats, I have on a heart experiment, isolated heart experiment, I have killed some 20 rats. So next week I will come, I will do on some fracture activity, break the bones, and then I kill those animals. Next day, what I do is I do some into some cancer or tumors, and then I try it, and it doesn't click, and all the animals suffer from cancer, they start dying. So lot of money is involved. So this is one advantage, one disadvantage. So in screening programs, we have primary screening, we have secondary screening. In primary screening, we have what is called as a dirty screening, or and then we have broad screening. Then via media, these are two extremes. One is one particular activity, another is all the activities. Now there is a via media. That is called as programmed screening. So in programmed screening via media, what these scientists do is they get some clue, they do a general screening of very few activities, important activities, maybe on heart, maybe on some activity on skeletal muscles, maybe some activity concerned with some anti-cancer activity. Like that, they choose very a group of activities, and then they start doing the research on that one and say that this has activity. Advantage and disadvantage both are there. Advantage is that what you have missed in the first screening, now you have a chance that in all probability it is better than the earlier. Again, you have chosen some, let us say 10 activities you have chosen. Maybe the drug is very good drug for 11th activity, which you have not tested because we have selected a via media. Better than the earlier, but inferior than the blind screening or entire screening. It's also called as blind screening, where we start testing everything for every activity. So these are the various types of screening processes that we have started. So it is basically a primary screening, and then we are going to secondary screening. So in secondary screening, you have got certain clues. To take those clues, and from those clues, you start doing studies only on that activity at a deeper level. Now, let us say I have tested only on first some 3 rats. I get a promising result somewhere. Then I do it on 10 rats. Then I do it on 20 rats. Then I do it on mice. Then I do it on rabbits. Then I do it on dogs. So like that, I keep on entering further into the details of that molecule. That is also one way of the studies. So very many such procedures have been recommended by various pharmacologists. So depending on our requirement, depending on our resources that are available with us, we can particularly do a particular activity for that particular drug. Now I have a particular drug. This is what we are doing in basically screening program. Animal can be anything. Animal can be rat or a mice, or generally we call rat and mice because easily bred in the laboratory. Suppose if you have a pair of rat, male and female rats, and live in the laboratory, within 3 months to 6 months, you will have at least 50 to 100 rats and mice. So that much is there for again growing these rats and mice. Hence, many laboratories depend on rats and mice studies only. Then we start getting results from that particular primary screening, and we go for next level of the studies for this one. So then how I have a plant extract which is a very crude brown mass of extract. How should I standardize this one? How should I purify this one? Where should I dissolve that one? Because it will have so many mixture of chemicals, we do not know which is responsible for what particular activity. So at that time, again, we should know how to dissolve, which solvent has to be taken. Maybe you dissolve first in water. It may be insoluble in water. Go for a suspension. If it is unfit for a suspension, go for dissolving in a dilute hydrochloric acid or add with a sodium hydroxide and pellet. Not, we should not make too much alkaline or too much acidic. That itself, acid and alkali, they themselves will start affecting. So there, what you have to do is that you should add the quantity that is sufficient. Suppose if it's 100 ml, maybe even small pellet of sodium hydroxide, so that it is solubilized. So that intention or that idea always we should have for dissolving a particular chemical or a drug that you have in your hand to make it into a drug. So these are some of the models by which we start doing our particular studies, and then with this, what we are supposed to do next. Next part of studies is our let us say general guidelines. As I said, I was putting the example of lion or a tiger as general this one. So what we are supposed to do this one, we should have a basic particular activity, because no two pharmacologists may come to a common conclusion. The reason being, suppose they are all animal studies, it all depends on particular basic nature of that particular person, how he is observing for the studies. Ordinary example, I will give one or two examples. Maybe we have a pet dog or a cat in our home. The dog and the cat would like to go to a particular family member rather than other family member who is harsh to that particular animal. We are all human beings, but our treatment starts varying. Same thing will happen with animals also. When we handle a rat, the way I handle can be different from the way some other person handles it. That will cause lot of stress, lot of blood pressure changes in the animal, and that blood pressure changes will make more blood flow to the other parts of the body, and more drug will be conveyed to that part of the body. You may get wrong results. So that is why two pharmacologists, one may get a 50% results, next may get a 65% result. This will not happen in analytical branch. There it will never happen. Suppose if one scientist is getting 99% purity, other will get 99 or 99.1%. Or if compound is 100% pure, one person may get 99.9% purity, other may get 101% purity. So margin is very narrow there. Whereas in case of pharmacology, this will never happen, because it goes with so many factors that are associated with the animal. Generally, we call the animal as a healthy animal. I am doing studies on healthy animal. But what is the definition of a health? How do you say that the animal is a healthy animal? We bring the rats, we start doing the studies saying that visibly the animal is healthy and is not. Who knows it is suffering from any endocrinal disorder? Who knows it is suffering from certain GI disorders? Who knows it is more prone for diabetes at that point of time? Who knows that the animal is undergoing stress conditions? Who knows that the animal has blurred vision? We do not know. But still we call that animal as healthy animal, because before testing, otherwise we have to do all the possible tests. You have to estimate its glucose level, you have to estimate its cholesterol level, you have to estimate its other biological insulin levels or hormonal levels, and so many other things. That itself will take the life of the animal. Then you have to declare that the animal is healthy animal, which is practically not possible. Hence, we call all these generally normal looking animals which can move around the cage, which that move, struggle for eating the food, which can drink the water, or which can have a normal activity. We say that it is a healthy animal. But more scientific term is a normal animal. Because I have told you, what is health? Defining becomes very much difficult. Somebody is a very lean person, but still very healthy. Somebody is a very fat person, a very stout person, maybe very weak or prone for diseases. We do not know. So that is how definition of health also keeps on varying. We should know about that one. Now everything has a basal value. As I said, some are natural models, some are basal models. Now suppose if you bring four rats and keep in a cage and sit in front of it for 1 hour, 2 hour, or you are sitting like that. So you are observing them. So in these 2 hours, some rats, normal activity, they run for a food once in a while, they run around the cage, or sometimes they climb the cage, or sometimes they eat the paper pieces that you have put there, or they may drink a water and again go and sit in a corner. All these activities can be seen in a particular rat or a mice. Then we say that yes, the animals are normal. So this is a basic behavior. You have to give some scale to this one. This is a normal activity. As we say, this normal person out of 10 is 8 marks are there. Out of 190 marks we can give. General, whatever we find. Suppose a person is a let us say 5.5 feet and 75 kgs in weight and move around on his own and carry out his day-to-day routine activity. We say yes, he is a healthy person. Same thing is true for the animals also, wherein we say that yes, the animal is a normal animal, the animal is a healthy animal. So we have to give a basic score for this one. Usually, the scientific or pharmacologist recommended scale is 0 to 8 scale. In 0 to 8 scale, 4 is a basal value. 4 is a basal value means that suppose if you keep 3 or 4 rats, watch them for 2 or 3 hours, that means the animal is urinating, the animal is passing, it's defecating, the animal is chewing the paper pieces, the animal is climbing the cage and trying a way out, or the animal is drinking water, or animal is eating its food. All these are all normal activity, a scale of 4. Now let us say you have given a particular drug. When you give a particular drug, now sit in front of those animals. Now the animal is not moving. 2 hours you are watching, the animal is not interested in the water. The animal is not drinking water at all. Or the animal is not eating the food at all. It has become disinterested in the food. Or the animal is not climbing the cage. Or the animal is sitting in one corner. So now your basic score was 4, you have to reduce that basic score. It may be 3, it may be 2, or totally animal is inactive, it can be 0. Or let us say, now earlier the animal was running around the cage, maybe in 2 hours for 5 times it has run around the cage. Now it is continuously running around the cage, continuously drinking the water, continuously eating the food, continuously eating the chewing the or cuddling the papers, or continuously it is showing ferocious activity or vocalization. Now from a scale of 4, which was normal, it has become hyperactive. So if it is hyperactive, then we can say that probably the animal is suffering from either some trauma or hypertension or a severe stress or an irritation or a pain or some constriction of the sphincters or maybe some spasmodic pain or maybe it is suffering from some uneasiness. We do not know. So you have to change the scale. Now it may be 5, 6, 7, 8. 8 is the maximum. 8 is the maximum in the sense 100% it is disturbed animal, irritation. So this is the scale by which we start recording as a pharmacologist when we start testing a new drug. In a clinical program, preclinical screening program, it is called a preclinical screening program. So in preclinical screening program, when we have a particular drug, what we have to do is you have to give to the animal and then start observing what it is doing after giving the drug. Now, giving the drug is also an art. It's a skill because drug, how you are giving that particular drug. The drug may be very good drug parenterally but useless orally. The drug may be very effective orally but may not be of much use when it is given parenterally, or it may produce instant reaction. Or the drug is highly toxic. Whenever we give orally, the animal dies. Whenever we give parenterally, the animal dies. But the drug may be very good acting drug on locally in the form of a cream or in the form of an ointment, something like that. Our drug is a very good drug, but we have tried orally, we have tried as a patch, we have tried as an ointment, it is ineffective, but it may be very good drug through lungs, insufflation directly, or maybe sublingually, it is a very good drug. So as a pharmacologist, we should be always alert about this phenomenon that particular given drug is suitable by this particular route. It may be oral route, it may be parental route. Again, in parental route, again, some drugs are given only by IM, not by IV. Some drugs are given by SC, subcutaneous, not by IV route. Isn't it? So many things we see in our day-to-day lives itself. So this is where it makes for a pharmacologist in a screening program, we should be always alert when giving a particular drug that this drug is useful by this route, in this solution, in this solvent, in this form, and then it produces. Again, so many factors are there. Crystal size of the drug may produce a particular effect. As we have seen with griseofulvin, the size of the crystal is changes the effectivity of this absorption of griseofulvin. So that can be one particular factor. Or while administering, you maybe you have added only a little quantity, thinking that you have already administered, but actually that animal has spilled the drug. All these precautions have to be taken by a pharmacologist while handling a particular animal, what type of animal it is, and then how a particular drug is given. So this becomes a particular skill. Then again, while choosing a new drug you have chosen, I had brought some rats and mice and then started giving it. Now we should know whether the drug is useful only in male rats or only in female rats. Female rats may respond to a particular drug in a particular fashion. Male rats may respond to a particular. Same thing with human beings also. You have all seen the tragedy of this thalidomide teratogenic drug. It affects only the uterus, isn't it? In pregnancy, it causes this phocomelia. Sealed hands and limbs are there. The drug was so much scared it was banned. But this can be used as an anti-emetic drug in men. No question of pregnancy, no question of teratogenicity. So that is how the drug that was banned in 1960s or so is now revisited once again, that it may be useful in AIDS, that it may be useful in other species of the animals, it may be useful in cancer. Right. As a pharmacologist, while testing, all our eyes and ears should be open and we should be attentive. Then position of the animal, how you are giving a particular drug, because if you keep the animal dorsally, the effect can be different. If you keep the animal ventrally, stomach side up, the effect can be different. This has happened with already atropine in rabbits. Dorsally administered rabbits gave different response. Ventrally administered. Adrenaline also same thing. If you tie to a board and to a rat and then give, the effects are different. And a free animal, the effects are different. So many such parameters come into the picture. As a pharmacologist, we should always test them with this vision or this in our mind, that this also can happen, this also can happen. Chloroform, male mice will respond in a very different way, female mice will respond in a different way. All these years we have used chloroform for human beings as an anesthetic. Only from last 2 decades it's totally banned, isn't it? So when it was earlier, it was used very much. It was used. So if you see the pharmacology, male mice respond in a different way, female mice respond in a different way. So that is how male species. Suppose if it is a drug is meant for a particular uterine activity or testicular activity, we can understand the logic that yes, this is a testicular activity, hence male rats are a suitable model. This is an ovarian activity or uterine activity, hence the drug is more suitable for a female rat. But when it comes to general drug like chloroform, which is used in both male as well as female species for anesthesia, where sex doesn't matter, but still affects the particular drug. So this is how the difference can be there while testing a particular drug. So we as a pharmacologist, again, we should be alert about all these things. Then we'll see, now we have seen what is the solvent, what is the mode, what is a basal reaction time, and how we have to score a particular animal from a 0 to 8 scale. Then how next to proceed, for so many aspects are there, like acute toxicity studies are there, chronic toxicity studies are there, and then subacute toxicity studies are there. In those studies, because one day you give, the drug will become very good drug and it will produce an excellent effect. But when it is used for 10 days, the same drug may be a cancerous drug. Or 10 days also fine, no change. If drug is used for 1 month, it may produce some effect, we do not know. Or that is also fine. If drug is used for 6 months for a disease, then it may start producing some new effect, which also we have to take into consideration. Simple example, arthritis. Sometimes people use drug continuously for a long period of time. Tuberculosis, people may have to use drug for 6 months to 1 year. Leprosy, drugs may be used for 1 year, 10 years, 20 years, life period. Cancer, drugs may be used for a prolonged period of time. AIDS, drugs are used for a prolonged period of time or till the lifetime of that particular subject. So there are so many such diseases are there wherein we need to use a drug for a prolonged period of time. But when a scientist has tested on some part of animals on for 1 month, 3 months, or 1 year and says that it's a very good drug, it comes into the market, but after 2 years it produces cancerous effects. So this is where it makes a lot of difference. So that is how every day drug inventions keep on going on, and every day some or the other drug is withdrawn from the market. You have seen so many drugs have been withdrawn from the market or banned drugs. Baralgan that we used to get, it's already banned. Metronidazole that was there is banned in outside India, but available in India. Saccharin banned outside India, available in India. Nimesulide banned across the world, available very freely in India. Nimesulide or nemisulide, both are the same names. Either it is called nimesulide, NIME, or nemisulide, NEMI. Both are same names. So nimesulide or nemisulide is banned in the 1980s in European countries. Today we are in 2022. That is after almost 40 years. Nimesulide or a NICE is one of the best-selling drugs. So many factors are there here. Why they have banned the drug? Probably they have studied some unwanted effects there. But why it is available in India? This is where, or as a pharmacologist, we should be in a position to define them. We should be in a position to address these issues. So that is how in animal studies, every animal we can use, any animal we can use, any animal, including house flies, also can be a very good animal. Mosquitoes can be a very good example because we want mosquito repellent, isn't it? Unless and until we don't have mosquitoes, how do you find out a mosquito repellent? Whatever the today liquidators are there, mosquito repellent mats are there, they have to repel the mosquito. Whether that particular thing repels a mosquito or not, we should have a mosquito. It may be lizard repellent, it may be a cockroach repellent, it may be a killing is one part, different part. Killing is directly you are giving some this one polynesterase, this one drug oximes, and you are killing the insecticide or a pesticide. You are directly killing there. But now we are not killing; we are simply repelling it. So to repel that one, you give poison, the animal dies. But we are only repelling mosquito. We want a repellent which sends the mosquitoes out. So we should have a mosquito. Then only we can say that. So like that, anything that you imagine, it may be a small mosquito, it may be a housefly, it may be a dragonfly, or it may be a honeybee, or anything that you imagine is a lizards. They are all very good models for a pharmacologist for carrying out various experiments. Now, the profile of studies, how do we define the profile of pharmacological study? That we have to take into consideration. The profile, we have important three parameters. One is the behavioral profile, that is subdivided into awareness, mood, and motor activity. Then we have neurological profile, that is subdivided into central excitation, motor coordination, and muscle tone reflexes. Then we have autonomic profile, that is subdivided into three types: optical signs, secretory signs, and general signs. I will tell you briefly so that once you catch what is the theme of or what is the crux of that study, automatically you can explain on your own, you can understand on your own by studying. First is behavioral profile. As I already said, the example of rat, you bring two rats, keep them in a cage, sit in front of it and find out what they are doing. From there, we are starting a pharmacological activity or screening of the drug. Our today's topic is preclinical screening. That is before a drug enters a clinic, how we are testing in the lower animals. So first is behavioral profile. Behavior means you bring the animals, sit in front of it, see what is happening in a particular behavior. So one is awareness. What has happened to the awareness of the animal? Awareness in the sense, suppose let us start with a common example of a dog or a cat itself. you have gone to morning office, and then or maybe outstation you have gone, evening you are coming. The moment you come to your home, your pet dog or your pet cat will wag its tail and start running to you. It will run to you, maybe it will start licking you, or maybe it will jump upon you, or it will give a shake hand to you, something like that it will do. Same pet dog, when you have come from outside, now is not interested in you. It's not wagging its tail. It's simply sitting in one corner. So now what can be the inference for that one? That is awareness. That is, we have come, but it has not noticed. If it has not noticed, what has happened to the animal? Is it under influence of some severe pain, or whether it is under influence of certain uh, disease, or whether it's under influence of some something that has caused the paralysis of the animal, or what has happened to the awareness of the animal? This is where a sorry, this is where a pharmacologist should take a note of it. So that is awareness study. So in the pharmacological profiling, in a preclinical screening, we first take note of awareness, whether the animal is aware or not. Or suppose if you bring a rat from an animal house, keep on your table, what it will do, it will not stay in the where you have kept it. It will start running to a dark place. It will first find a hiding place. If it will start finding a food for it, it will start finding some water source for it, or some dark place where it can go and hide itself. Now you have brought a rat in second set, you have kept on the table and a focus light, but animal is not moving. It's not finding food. It's not showing any interest in hiding place. That means it is under the influence of something, some drug, some tranquilizer, some which has affected its behavior or awareness. When awareness is affected, this can happen. So that is where this awareness plays an important role. So as a pharmacologist, when we give a particular drug, first observation is whether the animal is aware or not. This is called as behavioral profile. Second part of behavioral profile is mood. Mood in the sense, suppose if you have come from same thing, you imagine to any rat, mice, etc. When you have entered your home, and the animal is not wagging its tail, or even if you walk across, it's not taken a note of it, that means animal is not in a mood. This is now you may feel that sir is always quoting only home cat or home dog example. Now let us say we will enter into a forest. When we enter into a wild, maybe a zoo, let us say zoo, we have entered a zoo. Suppose if you have gone and near a tiger cage, it should, first thing is, it should roar, or it should start attacking you from cage itself. This is normal behavior. Now you go stand in front of cage, maybe a monkey cage, you go and stand, and you tease that monkey, or you do hissing of like a monkey, or you do some facial signs or hand signs, and the monkey is not interested in you. It's not seeing, taking note of you. That means animal is not in a good mood, or its mood is altered. It can be due to your drug that you are testing, or it can be due to anything. So this is where we have to test as a pharmacologist what is happening to the mood of the animal. These, now why we are doing all these things? Now in a mental patient, irritated patient, hysteric patient, schizophrenic patient, psychotic patient, neurotic patients, or any such patients, we need these drugs which alter the mood of that person. If a drug can change the mood of a person, general behavior of a person, these drugs are very useful for those kind of people where mood is disturbed, who become irritated, or who get excited on every occasion, or who undergo severe stress. There we have to change their mood levels. So we need these mood elevators. So this is one of the models for mood elevators. Where so many MAOs, monoamine oxidase inhibitors or mood elevators are there, analeptic drugs are there, caffeine-like drugs are there, isn't it? So many things are there. There we have to test all these things so that they become one of the very good models. So this is what is called as behavioral profile. So first is awareness, and second is mood, third is motor activity. Motor activity in the sense, what is happening to its activity. You have seen your dog in your home, it has a particular motor activity like wagging of a tail, or maybe it will sit in a particular fashion, or maybe it has a particular type of style of movement, anything. It may be a cow, it may be a buffalo, it may be a horse, it may be a donkey, uh, or it may be a dog, it may be a cat, whatever it is there, they have their own style of this motor functioning. So if that is altered, now we are speaking in context of screening only. I am giving day-to-day examples only. Day-to-day examples of dog and a cat. We are not testing any drug. Suppose if you are testing preclinical screening of a drug for motor activity, you give to rats and mice and observe these changes. That is the meaning of this one. That is, when we give these drugs to the animals, then we have to observe whether the given drug has altered its motor activity, its behavioral profile. If it is changed, you record that one. As I was telling, no two pharmacologists will record in a particular style. Because suppose when you come, your dog has only wagged a tail and it has not come. You may feel that okay, it's a normal behavior, not problem. Sometimes when you come, suddenly it starts jumping and coming near to you in a very active mode. So now, yesterday it was only wagging tail but not getting up from its sitting place. Today it has started running towards you. There is a difference between yesterday's behavior and today's behavior. Its mood is altered, its behavior is altered. Same thing happen with all these animals that are there. They have their own particular behavior. This we should take into account. Don't We cannot expect a dog to behave like a cat, or a cat to behave like a rat, or rat to behave like a tiger. That is not the case. Whatever the behavior that has been bestowed by a nature or a god for that activity, it should do that activity. Monkey should jump from tree to tree and start hissing, or this one tiger should behave in a pouncing upon the animals, and this one a deer should only try to avoid, or in a defense mode it cannot attack anybody. So this is basic behavior. So whether that basic behavior is altered, cow is a docile animal, it will never revolt for anything. Same thing with rabbits, very docile animals. Same thing with guinea pigs, very docile animals. Even if you prick a guinea pig, it will squeak, but it will not bite you back. If you cut some part of this one, it will squeak with pain, but it will not bite you back or attack you back. Try this with monkey, you cannot do it. Try this with even rats. Rat will give a very strong biting. It will bite the fingers itself. Ferocious animal. Whereas guinea pig, even if you handle very roughly, it will squeak. It will undergo tension. Its blood pressure is altered. It will undergo very severe stress, but it will not attack you back. Same thing with cows, docile cows. But dogs, it is not like that. Dog, you try to tease it, it will bark and bite. So that is basic behavior. Whether that basic behavior is altered, now you have some drug in your hand. Maybe some company has given you that drug, or maybe somebody has given that drug to you, or you have synthesized it, or somebody has extracted it and wants to that to be tested and on preclinical screening. And he says, you are a pharmacologist, you please do this and give the report. So when you give to the animal, this is what you have to observe there. What is happening to its behavioral activity. Next is neurological profile. Again, neurological profile is divided into three types. One is central excitation, second is motor incoordination, and then third is muscle tone reflexes. So in this, first is central excitation. That is, you give the drug to the rat and it starts getting irritated. Two groups of rats, one rat, even if you touch a rat, it may simply show an offensive this one, but may not be ferociously biting. Suppose in group one you have given some drug, and the moment you touch it, it jumps and then starts biting you. That means there is some problem with the animal. So that is called central excitation. So that central excitation has to be tested for this one. That is, centrally animal is irritated, it is stimulated, it is depressed, that has to be tested. Then motor incoordination is another parameter that we can test. In motor incoordination, whether the animal, its motor reflexes, whether they are coordinated or not. In simplest ordinary example I will give, so that you extend to the animal this one. You have seen a normal person walking on the road, or you yourself are walking on the road. Suppose if a person is a drunk person, if a person is a drunk person, he cannot walk straight, he cannot ride the bicycle straight, he cannot ride his motorcycle straight, or he cannot lift a particular maybe he is inserting a key into his car or a vehicle, so he is not finding that socket. Sometimes he finds 1 inch above it one or 1 inch below this one. This is motor coordination. That is whether the drug has caused motor incoordination. That is while placing a key. It may be anything. Just an activity. You can imagine any type of activity. It may be driving skill. It may be speaking skills. It may be any other skills, or art skills, or singing skill, or running skill, or any skill that you imagine in a particular animal or a particular living subject. If that is altered, that is motor incoordination is there. Give a drug, then report that yes, this drug is causing motor incoordination. This drug is causing mood alteration. This drug is causing behavioral changes. This is preclinical screening. And next is muscle tone reflexes. Muscle tone reflexes in the sense, now the muscles that are there, let us say I have kept this my hand on some table. Whenever I don't want, I can take it back very comfortably. Suppose same thing with a subject, a rat or a mice or this one, or a dog is there. It has kept its hands or limbs on some wooden plank, or rat is climbing its cage. Now, when it is climbing its cage, suppose if it is unable to climb the cage, suppose if the rat has kept its limbs on some wooden platform of maybe 3 centimeter, 4 centimeter, 5 centimeters, and it is unable to take it back. Commonest ordinary example is we have seen maybe our great grandfathers who are in the 90s or 85 years old, they sit in a chair, but they cannot get out of the chair. So somebody has to help them to hold their hands and then uh, pull them back. There is muscle incoordination is there. Same thing in animals. Suppose if you keep some animal in a particular posture, it is unable to come back to its normal posture. That is muscle incoordination. So this muscle incoordination also you have to report. So as a pharmacologist, we should start recording anything that is happening. It may be skin color, it may be eye color, it may be its vocalization, it may be skin change of fur, or it may be sweating activity or salivatory activity, anything that is any new thing is there from the earlier one before giving drug has to be recorded. That is a preclinical screening model. Then third activity is autonomic profile. So autonomic profile again subdivided into three types. In autonomic profile we have optical signs. Optical signs in the sense, suppose the pupillary size may be increased, pupillary size may be decreased, or eyes have become red, even given the drug and eyes have become red, or eye color has changed, or it has caused cataract to the animal, or animal is unable to locate where the food is, it is unable to see the food, it might have caused blindness to the animal. So all these activities, they are optical signs we have to test. Small animals like rat and mice, it may be difficult to find out this one, but larger animals like cats, dogs, eye activity can be very easily observed. So this is one of the important activities that in preclinical screening, when giving to rat, mice, we should observe this also. Then secretory signs in the sense lacrimal secretion from the eyes, or nasal secretion, or salivary secretion, or sweat, they're all secretions. So now some rat and mice, you will not find sweating and lacrimal secretion because very small eyes are there. But if it is a large animal, you can very well guess. In cows, we can find this tear formation. In other animals like dogs, we can find this one. Salivation, dogs, you can see that they salivate continuously. Lot of saliva, their tongue is always outside protruded, and a lot of salivation is there. Suppose if a drug has caused lack of salivation, it may be atropine like drug, or if more of salivation is there, so we have to find out what is the reason for that. It may be irritant drug, it may it's a silagogue that has increased salivary activity, so that we have to find out. Or cholinergic drug has increased salivation activity, or it may be sweating activity. This also we have to find out. So that is part of autonomic profile. Next, general science. General science in the sense so many parameters are there in the general science of the particular animal. It may be particular skill that the animal can perform. Uh, you can see so many skills. A dog can bring a ball or a newspaper, or in circus we have seen so many skills. Tigers perform some skills, parrots perform some skills, or some other animal, elephant or a hippopotamus performing some skills, something like that we see. So suppose if the drug has altered that particular skill, that is whatever the basic skills are there or whatever learned skills are there, if those skills are hampered, we have to record as a part of our general science that are there, what is happening to this particular animal. Animal is restless, or animal is running around itself, or the animal is has become berserk and running around a lot of area here and there. So all these general behaviors also we should observe. Suppose if it is a newborn calf is there, generally it keeps on jumping around the area, it's a normal activity. If it is not jumping, then abnormal activity. Some animals are there, they stay there only, but if it starts jumping, abnormal activity in that one. So this is what we have to find out. Yeah? But a newborn this one dog puppy is there, it will remain in that place only, it will not run away here and there. Suppose if it is newborn calf, the moment it is born calf, cow, if it is gives a calf, within few hours it starts jumping here and there. Say inborn activity. So if it is not doing that one, something is abnormal. This, this is another activity that we are supposed to take care of as a pharmacologist. When you give the drug to lower animals in a preclinical screening, we have to test all these activities and then find out. Then all these activities are based on its particular basal recording of 4. If it is increased, you have to keep on increasing the grades. If it is decreased, then you should keep on decreasing the grades, and then say that particular drug is a stimulant, a depressant, an irritant, and or hypertensive, hypotensive, hyperglycemic, hypoglycemic, whatever the activity that we find, we should be in a position to tell that particular about that particular drug. So this is what we have about some of the activities. Only some part we have seen, and still there are further activities like acute toxicity is there, chronic toxicity is there, subacute toxicity study is there, and then general pharmacological battery test, Irwin's battery test is there, and then how to extend the animal data to the human beings. We get some animal data. A drug is a very good drug in animals. It is a very good CNS stimulant, very good hypertensive drug. But in human beings, it doesn't produce any effect. All these things you have done very honest work. That the drug is a very good drug in a rat. It produces hypertension in mice. It produces hypertension in a rat, rabbits, in guinea pigs. But when it is given to human beings, no effect at all. This also can happen in pharmacology. So many examples I can give. One is simplest example is your morphine. Morphine we take as an example. Morphine, all the subjects and human beings causes meiosis. That is pinpoint pupil or constriction of the pupil. Same morphine, when it is given to cats, it causes dilatation of the pupil or mydriasis, exactly opposite effect. Suppose if you depend only on animal studies, you will say that morphine is an meiotic, but it is actually mydriatic in cat, but it is actually meiotic in all the animals. This also can happen. Suppose if you have tested phenylbutazone or oxyphenbutazone in a dogs and say that it's a very good anti-inflammatory drug, in humans it's an anti-inflammatory drug, but in dogs there is no effect at all. So this also can happen. So same thing, so many drugs are there. What results we were expecting, we will get exactly opposite effect. In cats, morphine can cause excitation and stimulation. In human beings, morphine causes depression and sleep, tranquilizer or a sleep type of effect. CNS depressant it is. Exactly opposite type of effect. So a drug can be exactly opposite. Drug may produce same effect. drug may produce an exaggerated effect. Or simple example is strychnine you take. Naxomic acids, all of you are familiar in pharmacognosy. So strychnine from Naxomica, even in slightest lowest doses, if you give to rodents like rat and mice, they die. There is a epilepsy simulation, epilepsy and convulsions and death will be there. But same strychnine in human beings is used as a nervine stimulant. Suppose if we depend only on animal studies, only I am doing animal study, rat study, mice study, and say that oh strychnine is very bad, it causes death. We should not use strychnine. Then we will not, we would not have had a very good nervine stimulant, isn't it? That means whatever data that is there in the animals may be true, may not be true. Strychnine today also, if you give to rats and mice, causes death. But same strychnine, human beings causes nervine stimulation, nervine debility, etc. They give in diluted doses. In diluted doses also it causes death in mice and rats. So whatever effect is there need not be 100% true. Maybe exactly opposite can happen. We do not know because we do not know what type of enzyme systems, what type of constitution, what type of particular thing that has been created makes a lot of difference. We do not eat grass, isn't it? Because we cannot digest the grass. Cows and buffaloes, they eat the grass, they digest the grass. We are also living beings. They are also living beings. We also have a mind and a heart and a kidney and everything. They too have a mind and a heart and a kidney and stomach. But we cannot digest the grass. They digest the grass. So whatever it is there in the animal doesn't mean that same thing is true for human beings. Simplest example is a grass because animals have cellulase, so they digest cellulose. Human beings do not have cellulase, so we cannot digest cellulose. So these are the basic differences. As a pharmacologist in preclinical screening, we should be always alert, or else we will miss upon all these activities. So this is how we have to make a beginning, and from where we get a drug, from how we start screening, how to select a particular model, and which is the most suitable model, which is most available, which is cheap, what are our resources. All these factors have to be taken into consideration. Then we can start. And in tomorrow's class, we can go for further about Irwin's battery test. I will tell, and then I will try to take up the issue of extension of animal studies into human studies and the alternatives, and then we'll go to GLP, good laboratory practices, CPC guidelines, etc. So this is what I think I have spoken for 1.5 hours. This is after my day's hectic schedule in the college. Hardly even 1 minute also I get in college because of very hectic schedule. But because this being teaching being a passion, but I will involve and I can share whatever the information that I have. Now the forum is open. If you have any doubts, you may clarify, or that's we are logging.
Participant, if any questions are there, you can ask. Hello.
Hello, sir.
Can you hear, sir?
Yes, very much audible. Yes. Very much audible.
So, participant, if you have any questions, you can ask. Or
hello, sir.
Tomorrow also, sir is with us.
Hello.
Hello. Yes, you are audible. You are audible. Please.
Sir, I am Prachit Bhagavadikar.
Yes.
Studying in second year M Pharmacy, Department of Pharmaceutics.
Okay.
So, sir, my question was regarding this preclinical strategies which are now which are going in different ways now. I want to ask, sir, what is the future of this? What will be the future of this for next 5 to 6 years? What other activities will be added, or some activities from these strategies will get reduced, or anything, sir?
No, going in different ways in the sense I am not getting. Can you quote any example?
Sir, for example, some process. Hello.
Hello. Tell. You are audible.
Hello.
You are audible.
Sir, for example, uh, these in these processes, for example, some trials or some drugs which are administered to animals, and these results are being observed. Uh, this is conventional, but in future, is there any scope to develop any other strategy from this?
There are so many alternatives to animal experiments they have developed. Earlier, what they used to do is earlier, if you can have 1 or 2 minutes, I can tell. Uh, Once upon a time, a methadone-like drug, when it was done, I think some children are there. They can mute the mic. If somebody is in home, please mute your mic. Lot of children are speaking. You can mute your mic. So earlier, when pharmacology, this is all a very new science from 1960s. This pharmacological screening has gained a lot of importance. Earlier, when these were the inventions were going on, so pharmacologists were so curious that one of the scientists injected in his body only one of the drugs, and then he tried, and then he died also. So this also can happen. And the most classical example is cyanide story. Cyanide is a deadly poison, we all know, and scientists wanted to do organoleptic evaluation by tasting the cyanide. He wanted to write what is the taste of that cyanide. The moment he tasted, he had a pen and a paper in his hands. He wrote only yes, and he died. Hardly it will take 2 or 3 seconds for the subject to die with cyanide. So even till today, we do not know whether cyanide is salty or sour or sweet, because all these three start from yes only. So this also can happen. However, they are all prohibited activities. Later on, lot of guidelines came, and then they started using animals rampantly. And later on, a lot of pet organizations came. They became aware. Animal rights activists became very much uh, you know a top priority, and various political leaders also were involved in this one. As we know, Maneka Gandhi played a lot of important role during for prevention of cruelty, etc. So, and scientists also started evolving their own strategies. And since without drugs we cannot imagine, no drug can produce its or predict its effect by chemical means, unless and until we test on your subject, living subject, we cannot say. But alternatives have been very well developed. One of them is an computer-based model. Other very good model is a patch clamp technique, or PCT model is there, and another is UHTS or HTS, ultra throughput screening or throughput screening technique is there. Then biotechnology techniques are there. The simplest classical example is your this one pyrogen test. Pyrogen test earlier they used to do in rabbits, give the drug, and through rectal temperature was recorded in rabbits. Now it is totally replaced by IP officially by LAL test, isn't it? LAL test, libulus lysate test, they have replaced it totally by another alternative method itself. Uh, so like that, so many developments are also going on, which is also equally reliable and equally dependable. LAL test. So now we don't use rabbits for pyrogen testing. So in a drug. So like that, new theories will come, but ultimately again, but what is the intention of that one? Earlier, as I said, human beings, scientists, they used to inject upon themselves only. Later on, they started using some animals freely, because animals, no organization, no reward they were using. Now that organization has come, so they have stopped the frog experiment, and now we need an CPC approval. CPC guidelines are there. We will discuss during that one, wherein we need an approval, how to get the animals, how to register, how to do activities with minimum torture, maximum output. And first we have to adopt all the strategies, then come to uh, animals. Earlier, first animals, last human beings. Now, even entering into animal domain, first we should test by all these means, by chemical assays, and then HTS assays, and then all whatever is available to you, do it. and last, if you are satisfied, yes, this is a very good drug, then start animals. Then the storage starts for preclinical screening, and again at the end of that one, we speak of human beings. So pharmacology has no replacement at any stage, but new methods have come. Scientists should adopt, and scientists are also human beings. It is not our intention to torture an animal, but our intention is to find a new drug that is useful both for animal kingdom, human kingdom, as well as plant kingdom also. It may be a very good plant medicine. So that is also one of the very good domains. So like that, lot of changes are there, but there cannot be any replacement to this one, pharmacology.
So, sir,
Any
yes. Tomorrow again we will discuss, sir.
Sure, sir. Tomorrow at
So
7 o'clock, we will go for further
tomorrow at
studies.
7 o'clock. Yes,
Yes,
sir.
sir. Yes.
So on behalf of all the participants and all of us, we are very much thankful to you, sir. You have discussed preclinical screening in detail, how which animal you have to use and how you have to do the test, all these things. So once again, I am thankful to you, and your voice was very clear and audible.
Thank you, sir.
We thought that you are in front of us.
Oh, thank you. Thank you. Thank you.
Okay, sir. Thank you. Good night.
Okay, sir. Okay,
Again,
sir.
we will
Good
meet
night.
tomorrow.
Sure, sir. Good
Okay.
night, sir.
So
Okay.
all the participants, you can leave the meeting. Thank you, sir.
Okay, sir. I will log out, sir.
Hello. Huh?
Okay. क्या शरकत करने